Third-party reproduction is a method that uses another individual or couple in order to achieve pregnancy. It includes the use of donor sperm, donor eggs, or gestational surrogacy. We'll talk a little bit about all three and the implications of each treatment. Donor sperm are turned to when there are uncorrectable issues for the man or if detrimental genetic diseases are carried by his sperm. Women also turn to donor sperm when a male partner or sperm source are unavailable, as with single women or same-sex couples. The preferred source of donor sperm is that of a commercial sperm bank that allows for anonymous donation of sperm. These banks test for communicable diseases and quarantine the sperm to ensure the safety of the specimen you will be using. On top of that, they can provide a medical history, psychological testing, age, and family history of your donor. Donor sperm used in Canada must be fully compliant with applicable Health Canada semen regulations and the Assisted Human Reproduction Act. Although Health Canada regulates the screening, testing, processing, and distribution of donor sperm, patients are allowed to review and choose the available donor's physical characteristics, ethnic and educational background, race, and health. Egg donation takes eggs provided by another woman obtained by IVF, fertilizes them in a lab, and then transfers them into the uterus of a woman who cannot achieve pregnancy with her own eggs. One reason for using donated eggs is decreased ovarian reserve and poor egg quality. Donated eggs are also used when a woman has premature ovarian failure, either naturally or as a result of radiation or certain chemotherapies, or if she's without ovaries or carrying certain genetic diseases. Donated eggs are also a solution in some cases for women who have made numerous failed in vitro attempts with their own eggs. Potential egg donors are required to provide a detailed medical history and undergo a detailed physical examination, including screening for infectious and sexually transmitted diseases, and counseling to address the emotional and legal impact of egg donation. Canadian law prohibits the commercialization of egg donation, including payment to the donor, the purchase of eggs in exchange for property or services, and the advertisement of these services. So obviously, finding someone who will do this for you for compassionate reasons can be very difficult for many couples. If a woman has had a hysterectomy or has an abnormal uterus or underlying medical problems which could cause risk to her or a baby in pregnancy, a history of multiple failed in vitro cycles, or repetitive pregnancy losses, a gestational carrier can be resorted to. To do this, an embryo is created through in vitro fertilization, and then it is transferred to another woman, the gestational carrier, who carries it to term for her. The woman carrying the baby makes no genetic contribution to the child. She is only providing the uterus to carry the baby. This woman, or gestational carrier, agrees that after the child is born, she will give up any legal rights she may have over the newborn, and the intended parents will take over parenting immediately. Gestational carriers like egg donors and sperm donors undergo a thorough screening, including a medical and a psychological evaluation and legal counseling before starting IVF procedures. Often a contract is signed, but this is not always the case. Canadian law prohibits the commercialization of gestational surrogacy, including the payment of the gestational surrogate. So once again, it can be very difficult finding someone willing to do this. While these treatments have enabled the miracle of childbirth for people who might otherwise be unable to achieve this goal, involving a third person in a child's conception raises social, ethical, moral, religious, and legal concerns. The decision, like most with childbirth, is an enormous one that must be carefully considered. And bear in mind the impact on the children conceived through this approach to family building.